Strategy number 14. Remember the nursing process. Use the steps of the nursing process to prioritize answer choices that present different nursing actions, especially when there are multiple correct actions among the answer options in the question. You must be careful to choose the answer option that would come first in the nursing process. 1. Assessment. Subjective and objective information is gathered, documented, and communicated. Certain words in the question may hint that the correct answer is an assessment option, such as check, collect, gather, monitor, find out, ascertain, identify, recognize, observe, or assess. 2. Analysis. Interpretation of the gathered assessment data. These questions require critical thinking to determine the correct rationale for a therapeutic intervention or prescription. 3. Planning. This step is about identifying patient problems, always prioritizing actual problems before potential problems, and developing the plan of care. 4. Implementation. The step of providing the planned care for your client includes interventions, monitoring, delegating, communicating, and documenting. 5. Evaluation. Assessing the client's response to the care and comparing the actual outcome with the planned outcome. Watch for negative STEM questions in these questions, i.e., which of the following findings indicates the treatment was ineffective? Note: answers for questions in the implementation step or for any question STEM asking for an intervention are typically nursing actions like giving a drug, a dressing change, or a position change. But an intervention can also be an assessment if it is implemented as part of the nursing plan to continue to monitor or follow up on data previously collected,